Okay, you know that bottle of aspirin? The one that's probably in your medicine cabinet right now? We all think of it as the go-to for a simple headache, but what if I told you that inside that unassuming little pill is a secret agent, one that's capable of carrying out life-saving missions? Well, today, we're going deep undercover to uncover the hidden story of aspirin.
And this right here is the central mystery we're tackling. On one hand, you take it for a mild headache. Annoying, but not exactly life-threatening. But on the other hand, it's a frontline defense against a major heart attack. So how can one drug operate in two completely different worlds? How can it be the right tool for both of those jobs? That's exactly what we're about to find out. So here's our mission briefing for today. First, we'll uncover aspirin's secret identity. Then, we'll look at how the mission works. We'll find out when aspirin gets the call for duty, cover the critical abort codes, and we'll finish up with your field manual, the practical stuff.
All right, let's kick it off with Section 1, aspirin's secret identity. It's time to look past its reputation as just another painkiller. So officially, aspirin has 4 key powers. We all know the first 3, right? It's an analgesic, so it helps with pain, it's an anti-inflammatory, and it's an antipyretic, which is just a fancy way of saying it reduces fever. But it's this 4th power that's the real secret sauce, antiplatelet. This is its ability to stop blood clots from forming, and that's what elevates it from a simple pain reliever to a genuine life-saving agent.
So how in the world does it actually pull this off? Let's jump into our next section, how the mission works, and really see what's happening inside the body. It's really a 3-pronged attack. First, it decreases inflammation, which is why it works for pain. Second, it helps widen your peripheral blood vessels. But the crucial part, the one that matters most in an emergency, is step 3. It decreases platelet aggregation. Now, in simple terms, that just means it makes your platelets, those are the tiny cells that rush in to form clots, less sticky. It stops them from clumping together and blocking up your arteries, which, is the very thing that causes most heart attacks.
And this timeline really shows you aspirin's split personality. You'll feel it start to work on a headache in, say, 15 to 30 minutes. And that pain relief, that lasts for maybe 4 to 6 hours max. But its mission against blood clots, that antiplatelet effect, that less sticky superpower, can last for an incredible 4 to 10 days. All from just a single dose. That's a huge difference.
So, with a power that strong and that long-lasting, when exactly does aspirin get the call to go into action? Let's look at the official reasons for using it, from the everyday stuff to the life-or-death situations. So yeah, you've got the familiar mild to moderate pain or fever right at the top. But then, things get serious. It's used for unstable angina, that's chest pain from bad blood flow to the heart, and pretty much any symptoms of ischemic chest pain. It's also used to prevent a first heart attack, what doctors call a myocardial infarction, or to stop it from happening again. But this right here is the headline. This is the big one. The official guidance is crystal clear. It is strongly recommended for all patients with acute coronary syndrome, or ACS. Now, ACS is just the umbrella term for when blood flow to the heart gets blocked suddenly, like in a heart attack. And in that moment, aspirin isn't just a good idea, it's an absolutely critical first move.
Okay, so aspirin is a hero in a heart attack. We've got that. But are there times when using this secret agent would be a really, really bad idea? A catastrophic mistake? The answer is a huge yes. And that brings us to our next incredibly important section, know the abort codes. These are the critical situations where you absolutely should not use aspirin.
And this stuff is non-negotiable. Don't take it if you have a known allergy. And notice the pattern here, active GI bleeding, a hemorrhagic stroke, a known bleeding disorder. See? Since aspirin's whole superpower is to stop clotting, it can be incredibly dangerous if you're already bleeding somewhere. And one more critical point. It should never be given to children with flu-like symptoms because of the risk of a rare but very serious condition called Reye's syndrome.
Now, besides those absolute do-not-use situations, there are also some more common side effects to be aware of. Things like stomach irritation, heartburn, indigestion, even nausea. These are pretty common because aspirin can be a little rough on the stomach lining.
All right, let's pull all of this crucial info together into our final section, your field manual. This is the practical, how-to-use-it guide for dosage and administration.
This chart lays it out perfectly. For mild pain or a fever, you're looking at a standard dose, 325 to 650 milligrams every 4 hours. But for a heart attack, for acute coronary syndrome, the instructions are completely different. The dose is similar, 160 to 325 milligrams, but look closely at the instructions. It says to chew
a non-enteric coated tablet immediately, and that one little word could literally save a life. I am going to say that one more time because it is the single most important thing to remember in an emergency. In a potential heart attack, you chew the aspirin.
So why is chewing it so important? Well, it's all about one thing: speed. Chewing breaks that tablet down and lets it get absorbed into your bloodstream way, way faster than just swallowing it whole. And in an emergency, where every single second counts to stop a clot from getting bigger, this is how you get that secret agent on the job, STAT.
So, let's run through the mission debrief one last time. Number 1, aspirin's secret power is its antiplatelet effect. It makes your blood less sticky. 2, it is a critical first-line treatment for a heart attack. 3, in that emergency, you must chew 160 to 325 milligrams of a plain, non-coated tablet. And 4, always know the risks, the abort codes, especially if there's any history of bleeding issues.
You know, it just goes to show you how an ordinary, everyday item can hold such extraordinary power. It kind of makes you wonder, doesn't it? What other life-saving science is hiding in plain sight, right there in your own medicine cabinet?